Hi, Hello. Hi, everyone. I'm Dr. Shubhaa Chawla, and I'm the founder of Relayed. So let's talk about a very pertinent problem. The US has a massive nursing crisis. There are 4.1 million active nurses, and the demand is only growing. We're short of 500,000 nurses even today. And obviously, nurses are overworked, and they're not able to take care of patients because they're spending 40% of their shift documenting patient information. And despite that, 80% of the major medical errors are happening due to poor handoffs, which is just poor documentation. So what is the solution?
Entering Relate, we're building the AI nursing sidekick that is giving nurses time back to take care of their patients. How does Relate work? First, we convert nurse conversations by doing ambient listening and producing nursing notes. Then we take these notes and we produce structured handoffs and flow sheets with added smart nudges based on clinical context to help these nurses. Finally, we take all these context and we push it straight into EHRs like Epic and Athena. Our secret sauce? Seamless handoffs in seconds. So an oncoming nurse can just scan a QR code and she will instantly get all the patient context from the previous nurse. And this is working. So with our pilot at UPMC, we've observed a 40% reduction in documentation time, 20% less documentation errors, and we cut back charting in half. Then we took a second pilot at Duquesne, and we improved on nursing satisfaction by 30% by iterating on our first pilot and providing a better UX and an overall lower cognitive load. We are now working with a third pilot with Tampa General Hospital in Florida. Our goal in the next 3 to 4 years is to close $1 million in ARR. We are essentially the only ones building a workflow that solely works for nurses. Other tools out there are trying to force fit doctors' workflows into nurses, but we're building proprietary AI models and we're optimizing for workflows that actually reflect nurses' work. We're charging $500 per nurse per year, and at an average salary in PA of about $80K per nurse. If we save at least 20% of the costs, we're looking at about a 15x ROI. And this is a huge market. So if we take this $500 and we multiply by the roughly 4 million nurses in America, we get a $2 billion market opportunity. We're raising $1 million in pre-seed to close the first 2 hospitals and reach $250,000 in ARR in the next 12 to 18 months. And we use this capital mainly for onboarding new hospitals, running more pilots, and getting the compliance SOC 2 licenses that will allow us for getting business with these hospitals. If you believe that nurses deserve better, join us in building Relate.
So one of the biggest challenges when nurses are talking to patients is that nurses deal with multiple patients in a time, right? They're not just talking to one patient. So when Abridge was looking, even Suki Health, when they were looking into the nurse practitioner space, they realized that it's not just voice AI, there are so many other elements in ambient healthcare that comes into picture. So that's the challenge that they face. So what Suki is doing right now is that they are embedding voice, collecting ambient healthcare with smart beds and like whatnot because of this dynamic changes. So it's not true that they're only serving physicians. They are looking into other spaces. And the second thing is Epic is like a big challenge here because they are entering ambient health as well. What are you thinking about that space? Now, if considering Epic's stickiness, how would you compete with them?
So I completely agree with you. There are other companies which have started looking into the nursing space, but we are trying to move fast and we're creating something that's only for nurses. So far, most of the companies that exist, they've built physician solutions and they're trying to sort of repurpose the physician solutions for the nursing space. We're trying to take all of our data based on nursing workflows. We're training proprietary LLMs just based on nursing data, and that's what our main differentiator is. Coming to the point that Epic is also entering the ambient space, we are well aware of the fact that Epic is also trying to come into the space. But the way we're trying to do this is we're trying to go after smaller hospitals as well. Tampa General is a big hospital that we are getting to work with, but we're also parallelly targeting smaller hospitals which don't have Epic integration so that we can capture that market as well.
So you have a slide that indicates that you would actually save something like, there's a slide that talks about savings, cost savings. So this is like the $1 million question. How do you convince an administrator you're actually going to save them that? How do you create that connection?
Can you move to that slide? 1 second. You're talking about. Sorry. Sorry, I'll just take the question.
Fine.
The way we've done it is we've done pilots, and all of our data is based on the pilots. So from the 2 previous pilots that we did, one at UPMC and one at Duquesne University, we gave them all of this information. And a lot of departments these days are looking for nursing innovation solutions. A lot of nurse executives are looking towards solutions which will make a nurse's life better, because the number of errors are extremely high and they're overworked, and also nurse turnover is a major problem in hospitals. So the way we're convincing them is based on